And welcome to our third and final webinar on supporting participation and inclusion. In this session, we will discuss identifying opportunities for community participation and social inclusion, implementing strategies for community participation and inclusion according to individualised plans, and identifying, addressing and monitoring barriers to community participation and social inclusion. In this session, we will focus on clients with disabilities. Let's begin this session with talking about what disabilities are. What does the term disability mean to you? Disability can be defined in many ways, depending on the perspective, how the information will be used and where it will be used for. In Australia, many data collections use a definition of disability specified by the World Health Organization. As per the World Health Organization, disability is like an umbrella term for any or all of the following components: impairments, including problems in body function or structure; activity limitations, including difficulties in executing activities; and participation restrictions, including problems an individual may experience in involvement in life situations. Disabilities affect people in different ways and at different levels. Two individuals may have the same disability, but the effect on their lives may be entirely different. Disabilities occur at any stage of a person's life. It's important to know the different types of disabilities in order to handle and manage the disability appropriately and sufficiently. The types of disabilities people face from physical to mental impairments. But the one thing that is common to all types of disabilities, which is important to acknowledge, is their ability to interfere with one's capability to perform day-to-day activities. The following are different types of disabilities. There is mobility and physical impairments, spinal cord disabilities, brain disabilities, including head injuries, visual disabilities, hearing disabilities, cognitive or learning disabilities, psychological disorders, and also invisible disabilities. These are disabilities that are not immediately apparent. For instance, some people with visual or auditory disabilities who do not wear glasses or hearing aids, or are discreet with their hearing aids, it may not be seen that they have actually got a disability. We're going to look at some activities that can be used for people with disabilities. These are important to the well-being of all individuals, and they should be promoted and made accessible to people with disabilities. Engaging in worthwhile activities has numerous benefits, such as better health, improved disposition, and broader social networks. There are many activities that can help people with disabilities to socialise, express their feelings, show their talents, and to stay healthier. To get the best results from activities for the disabled, it is highly recommended that activities are based on the individual's skills, interests, physical abilities, level of socialisation, and therapeutic benefits. When people with disabilities are engaged and active, they tend to focus on their capabilities rather than their limitations. They gain more self-confidence and improve their self-esteem. Take a moment now to think of some of the activities a client with a disability could participate in. Let's now think of some examples together. One example is art therapy. This is a good way to encourage people with disabilities to respond. Art provides a way for individuals to express thoughts and feelings, especially when there are constraints that limit them to write or to speak. Art also encourages individuals to develop their creativity. Painting, scrapbooking, and jewellery making are just some examples of art activities. Music therapy is another effective tool. Activities can be as simple as singing, humming, or having everyone clap their hands and tap their feet along with the music. Playing a percussion instrument is another popular music activity that allows individuals to feel the rhythm and vibrations these instruments create. According to the American Music Therapy Association, music stimulates the senses and therefore can help to improve an individual's mental, social and emotional well-being. Another example is physical activity. Exercise and physical activities benefit people with disabilities. This prevents them from living a sedentary life, which exposes individuals to the risk of type 2 diabetes, heart disease, obesity and high blood pressure. Physical activities may include things such as swimming, dancing, gym and yoga. Another type of activity that people with disabilities benefit from are nature activities. This is to be out and about in open spaces, breathing in some fresh air and appreciating the natural surroundings. A scavenger hunt or a summer camp is an example of a nature activity. Outdoor recreational activities such as swimming, boating, fishing, hiking and exploring nature are some other examples that will allow a person with a disability to socialise and to enhance their people skills. There are many specialised goods and services that are designed to assist people with specific needs. Let's look at some of these specific support services. There's accommodation support. This helps people with disabilities to live in the community and in a home-like environment. This may include things such as personal care or a personal care attendant assisting them with day-to-day tasks. There's the Access City Hotline. People with disabilities who have difficulty using doors or stairways or getting into buildings or using footpaths can access the Access City Hotline to assist with signs and directions. There's Start for Children with Disability. This is an initiative that aims to promote children with developmental disabilities to access funding to be able to get early intervention services. This can make their lifestyle better and give them a fairer chance and a better start in life. There's also Disability Employment Services. This is specialised help provided to people with disabilities to enable them to get and keep a job. There's the Disability Parking Scheme. Eligible people can enjoy the benefits of parking very close to their destination. In order for them to enjoy this, they have to apply to the Australian Disability Parking Permit. Then there's Livewire. This is a community designed to help young people who are living with chronic illnesses or disabilities. It's safe and fun and accommodates the parents and the siblings of the people with a disability. They're able to share their experiences and this forum is found online. Then we've got the National Auslan Booking and Payment Service. This provides those with hearing impairments with interpreters. Those who use sign language need an interpreter to be able to communicate with other people who do not understand sign language. For example, if they have a private medical appointment, they must be able to communicate with the health professional in order to get the service they want. So therefore, they might use this service. Then we have the National Companion Card. For people with disabilities, they should be able to participate in activities and events without having to pay another ticket for their companion. The Department of Social Services is in charge of making this happen by providing a National Companion Card. I'm sure by now a lot of you will have heard a lot about the National Disability Insurance Scheme, also known as the NDIS. The NDIS is the new way of providing support for Australians with disabilities and also providing support for their families and their carers. It will provide support for approximately 460,000 Australians who are under the age of 65 that have a permanent and significant disability. As this is an insurance scheme, the NDIS takes a lifetime approach in investing in people that have a disability early on to improve their outcomes later in life. The NDIS supports people with disabilities to build skills and capabilities so they can participate in the community and so they can seek employment. The NDIS helps people with disabilities to access mainstream services and support, access community services and supports, maintain informal support arrangements, receive reasonable and necessary funded support. For further information on the NDIS, visit the website www.ndis.gov.au. There's a lack of availability of transport services for people with disabilities. Limited access to transportation means limited access to important services and facilities, such as education, healthcare, or employment. Transport is an important support service which enables a person with a disability to enjoy many aspects of the community. Solutions proposed to curb this problem put emphasis on increasing the accessibility and affordability of transport services and providing some alternatives, such as expanding the taxi sector, a bonus system for taxi drivers who do their job well, a national-wide travel card concession, training of transport operators. Most of the problems that people with disabilities have with regards to transport are magnified for those in rural and regional areas. Transport is important in these areas to help reduce the risk of social isolation. One way to drive transport and mobility management is to create better public awareness about these issues. People that have a disability who are unable to travel to and from their destinations should be provided with transport assistance. There are several programs that address this need, and therefore some of these programs are specific to the individual, depending on the individual's circumstances. Let's look at some of these programs. First up is the Assisted School Travel Program. The Department of Education and Community's Assisted School Travel Program is on its mission to provide free, specialised transport to and from school to eligible students that have a disability. All applications for assisted school travel are assessed based on the program's eligibility criteria. Another program is the Transport for Disability Action Plan. The Disability Action Plan contains an action plan that intends to improve facilities and features of transportation for people with disabilities. It includes, but is not limited to, the accessibility of stations. This includes easy access for wheelchairs, electronic indicators and tactile indicators for people that have visual impairments, audio and visual information rather than just visual information or rather than just audio information. The accessibility of trains is another thing that this action plan looks at. This includes dedicated wheelchair spaces, priority seats for the elderly and less mobile passengers, accessibility for emergency help points, audio and visual destination information, and colour contrasted doors and handrails for people that have visual impairments. These are just a couple of the programs that are in place to try to assist people with disabilities to get to and from their location. When working with all clients, including clients with disabilities, it's important that we recognise and accommodate their cultural and religious needs. Beliefs and culture are considered important and personal. Values are formed early on in individuals' life, and this is around their culture and behaviour to situations. Understanding the reasons for individuality and culture is very important to cultivate a positive environment for everyone. Let's now look at some ideas on how we can recognise and accommodate diversity. We should be respectful of cultural practices and attitudes and beliefs, such as removing shoes before entering a client's home, if this is something they wish for visitors to do. Empathise. Think of the needs of others from their point of view. Be polite. Use the preferred title and the preferred name of the client. Show sincere interest in what the client is trying to tell you. Respect a person's right to privacy and confidentiality. That is a couple of things we can do to recognise a client's individual differences. When addressing a person from another culture, you may need to consider the following: different ways of speaking, or a title that a client may prefer. Male and female roles can be clearly defined along cultural boundaries. Different speech patterns and languages, codes of behaviour, gender-specific tasks, on-verbal communication and body language, such as the use of eye contact, The use of eye contact can be appropriate in some cultures, but in other cultures it can be seen as a sign of disrespect. And the use of personal space. Be aware of when you're communicating with clients, not to get too close to them or get within their personal space, because that also can be very off-putting for a person and be seen as a sign of disrespect. When working with a client from a different cultural background from your own, you may come across cultural barriers. These can include language and communication barriers, cultural norms such as the understanding of and attitudes towards illness, disability and ageing. Issues relating to ageing and disability may be exacerbated by factors such as ethnicity, religion, language, and the client's migration and settlement experiences. We need to be aware of the different perceptions of the role of carers. We need to also be aware of the impact of pre- and post-migration and settlement. Another issue that you may come across when dealing with clients is the experience that a person or a family member has gone through. You want to set aside your feelings. You want to make sure that you're not judging anyone at any given point. And finally, you need to be aware of the reluctance to deal with government agencies. A client may have had a negative experience of war, conflict, trauma in their own country or their country they previously were living in, and therefore they may be reluctant to deal with government agencies. On occasions where cultural barriers arrive, we can follow these principles. Integration. Cultural and linguistic considerations are integrated into all aspects of planning, policy and service delivery. We should value cultural diversity. What this is talking about is the cultural and linguistic and religious diversity is recognised and seen as a valuable asset to the community. We should share responsibility. The commitment to cultural competence should be sector-wide, not just an individual trying to take on the responsibility. We should have mutual learning and respect. All staff, communities and services should acknowledge that learning is a two-way process and it's based on mutual respect. We also should have strength-based support. The strengths of an individual, their family, carers, staff and communities should be recognised and built upon. And finally, when addressing cultural barriers, we need to consider accountability. Every individual should be accountable for cultural responsiveness and accessibility of the services and the programs. People with disabilities should be encouraged to join other groups, particularly groups of people that have same interests or similar interests to theirs. This will allow a client to foster their relationship with community members and build a support system. According to Angela Novak, who did a PhD, the following strategies were found to be useful to support relationships with community members. Some strategies will be more useful than others for any particular individual. They are all useful for brainstorming ideas. First thing we want to do is identify who the person already knows and where their relationship can be strengthened. Your client may attend a community day centre. Find out who they get along with at the community day centre and see if you can organise for the client and this person to attend another activity together. Identify where you can find a person that has the same interests as your clients. You may need to speak to other support workers or family members to do this. Thirdly, you can identify associations and clubs that have the interests that your client has. This will allow the client to have the chance to socialise, participate, contribute, and be contributed to. Next, we can identify community places where people engage in one of the person's interests. Do this by researching places or look for events. Search for the person you can reach that can help you connect other clients or people with disabilities that might have like-minded interests and ideas. Then you want to identify community places that are hospitable and welcoming. There are local places, businesses and neighbourhood groups that are extra helpful and welcoming to people with disabilities. They make sure that a person with a disability feels comfortable within the environment. And finally, identify places where a person with a disability can fit in the way they are. Some individuals with disabilities have what we call a challenging behaviour. In this case, it's recommended not to fix or change the person. You would want to search for a place that can accept the client as they are and make them feel comfortable within the situation. We are now going to look at support plans and barriers. Support plans are developed through the collaboration of allied health professionals, the person with a disability and caregivers. Progress should be checked by setting review dates and applying modifications when goals are not getting met. People with disabilities at times may encounter factors that prevent them from fulfilling their needs, goals and interests. These barriers can be environmental and physical barriers. Let's have a look at these in more detail. There can be architectural barriers, such as accessibility problems like trouble accessing a building. There can be attitudinal problems and barriers. This is around stigma and negative attitudes of people within the community. There may be transportation barriers. The client may not be able to get to and from the activity they wish to go to. There may be economic barriers. This may be due to limited financial support and funds. And there may be barriers of admission. This includes social exclusion and discrimination of people. A person with a disability is also at times confined by their own physical, emotional and cognitive limitations. These limitations or barriers that are within and from the individual can be either temporary or can be permanent. Let's have a look at some of these barriers now. There may be skill or challenge gaps. For example, there may be issues with their social skills or employability skills that they struggle with. There may be behavioural or attitude barriers. The client may have a tendency to be uncooperative or to withdraw from the situation. And finally, there may be health problems that cause barriers. A client may be physically unwell and may become isolated due to their illness. The principles and best practices of inclusion are a reliable basis for identifying and overcoming barriers to participation. The approach may include the following: applying a person-centred approach. I'm sure by now you're all well aware of what a person-centred approach means. You also want to build a partnership with the community and encourage cooperation. You want to involve the family of a person with a disability. And finally, provide open options and opportunities specifically for the individual based on the person's goals, strengths, abilities and their interests. The physical features of buildings, establishments and premises can create barriers for people with disabilities. Some of these barriers include steps, stairways and curbs, the floor and paving, doors and gates, toilet and washing facilities. Have you ever noticed that when you go to a local cafe or restaurant, often they don't have any kind of disabled toilet where a person can be toileted or wash their hands? It would make it very difficult for these clients of ours that have physical disabilities and may be in a wheelchair to attend such premises. Another issue can be lighting and ventilation. Under the Disability Discrimination Act, reasonable adjustments should be made to overcome these barriers, such as removing the physical feature altogether, modifying it in such a way that it will no longer be considered a barrier, or providing reasonable means of allowing a disabled person to avoid that feature or that barrier altogether. We're now going to look at two physical barriers and solutions to these. The first one is a parking space that's too narrow. A simple or low-cost solution includes using cones and/or tape and a temporary sign to mark additional space required. A high-cost solution includes restriping the parking area to include the required widths for accessible parking. Another physical barrier, a high countertop for a check-in area or desk where a client would need to sign in. A simple solution would be to place a sign-in book at an area or at a level where a person in a wheelchair could access it. A more involved or high-cost solution would be to install a lower countertop or a lower section of a countertop so that clients with disabilities that are in wheelchairs could access the sign-in book. At times, leisure and health workers may need to evaluate their own skills and limitations to be able to handle issues properly and seek advice and assistance when required. It's important that leisure and health workers are familiar with the policies and procedures of the organisation in which they're employed. You may refer to these when providing advice when there are requirements for communication support or physical barriers. We're now going to talk about delegation, referrals and handover. Delegation involves requesting another support worker, usually with the supervisor or management's approval, to provide care or to assist you with providing or looking after a client. Referral involves transferring, in part or full, the responsibility of the client's care. This may be necessary when the support requirements is outside the expertise or the competency level of the leisure and health worker. And finally, handover. This is the process of transferring all responsibilities to another leisure and health worker or service provider. Maintain awareness of your own professional limitations and knowledge gaps. Handover usually occurs at the beginning and end of shifts so that the staff coming on are aware of the requirements of the clients that they're caring for. When working with clients, it's important that we follow ethical standards. Ethics is the beliefs that constitute the right conduct in a particular situation or a job. A sound ethical framework is necessary for providing high quality care and to protect the rights of individuals with disabilities, especially those that may have more complex needs and therefore are more vulnerable. One element of ethical standards in the setting of providing care and services for people with disabilities is being straightforward and honest, with a level of competency that a leisure and health worker possesses. If there are uncertainties in their work, they should always go and seek support or advice from their supervisor. Ethical guidelines are important in providing a safe and clear working environment. Transparency is the key and setting of expectations that should be conducted to lead the worker to perform well and accordingly. Individuals providing services should also have adequate training, skills and knowledge to be able to serve effectively within the community. In order for leisure and health workers to recognise their own limitations, they should understand their role, the goals and objectives right from the beginning of their employment. Codes of practice are put in place to ensure that all the rights, needs and preferences of a disabled client are upheld to the required standard at all times. There are a range of other codes of practice that may apply to service delivery for people in a home and community environment. These may include the Discrimination Code of Practice, the Disability Code of Practice we just discussed, the Work Health and Safety Codes of Practice, the Community Service Codes of Practice, and the Ethical Codes of Practice. Leisure and health workers are often required to make decisions according to the ethics and philosophies of their organisation. Behaving in a way that's ethical and adhering to the policies and procedures of the organisation is very important when providing quality care and services to our clients. It's the responsibility of management to develop policies and procedures which reflect the values, objectives and the purposes of the organisation. It's the responsibilities of the staff then to familiarise themselves with this relevant information and to ensure they comply with this. Position descriptions are a good way for staff to establish the scope of their work. These descriptions provide information about the scope of their work and the duties that are required to be performed. Policies and procedures provide valuable information about how the work should be done. If at any stage when you're in a work role and you're unsure about your scope of work, you should consult with your supervisor or manager as soon as possible. We're now going to talk a little bit about empowerment and the principles of empowerment. Gaining or maintaining independence is a very important aspect of empowerment for people living with a disability or for people who are ageing. It is essential that a range of steps are taken that will assist in guiding and enabling choice and self-determination in a positive and supportive manner. If you do not empower a client, often they lose their self-confidence and begin to feel down and don't try to continue to do things for themselves. It's important that we encourage clients to be involved as much as possible in the services they receive and that we receive feedback from them to determine if they're happy with the services. Now talk about active citizenship. Victorians with a disability should be active participants in their lives. Victoria has made some important inroads over the last decade or more. We have the Victorian Disability Advisory Council. This is made up of people with disabilities and their carers, and they advise the government on disability issues. Around 20% of all Victorians have a disability. This is a large percentage. That's 1 in 5 Victorians have a disability. Therefore, it makes sense to ensure the needs and the experiences of this large part of our community are included in public debate and decision-making forums. Being connected and having a sense of belonging is fundamental to everyone's experience for a full and rewarding life. Not only that, as a community, we benefit enormously from diversity and the richness of ideas, experiences and knowledge that people with disabilities bring to cultural, sporting, social and civic life. Integrating opportunities for people with a disability to participate in the mainstream supporting activities and sport clubs leads to both increased social participation and it helps break down negative attitudinal barriers about people with disabilities. We need to support all members of the community to get involved and to contribute as active participants, decision makers, leaders, spectators and also volunteers. Our final topic in this webinar is community inclusion. If we start off by looking at this quote by Quass and Fraser from the Beyond the Ramp report in 1994. Presence without participation can be more isolating than no presence at all. So what is inclusion? Inclusion is the process whereby every person, despite their age, disability, gender, cultural, religious or sexual preference, every person who wishes to access and participate fully in all aspects of an activity or service has the right to. Inclusion requires time, space, effort and resources. Inclusion is often confused with integration. Integration means the physical presence of a person with a disability. This may mean specialised classes or segregated group activities outside of the mainstream classes in an educational setting. It also may mean a person with a disability being in a mainstream class and having a separate program, or not joining in the same social and learning opportunities as other members of the class. When we talk about inclusion, these are some important things to remember. Be open and welcoming to all. This should be reflected in your organisation's policies and procedures. Discuss the individual's needs and expectations with them personally. Obtain disability awareness training for yourself. Develop a partnership with others that supports inclusive practices such as local disability organisations. Invite people with disabilities as full participating members into your committee and other planning and decision-making forums. Above all, attitude can be the greatest barrier to inclusion, which often requires a creative shift in thinking rather than a large financial expenditure. I'd like to thank you for your participation in this webinar. Continue now by watching this video on the National Disability Scheme, then go on and do your quiz and your assessment. Thank you for your time.